out there. Welcome to my channel, All Things Psych. My name is Brittany. I am a licensed clinical psychologist and an adjunct professor. On my channel, you will find EPP preparation videos that provide helpful tips for a career in psychology, as well as applications of psychological principles and theories in current events, as well as some interesting stories detailing my experience as a practicum student and overall working in the mental health field. So if you're interested in any of that additional content, please subscribe to my channel and turn on that notification bell so that you never miss a video. Hello out there in YouTube world, welcome back to my channel, All Things Psych. If this is your first video of mine that you are checking out, I hope that you enjoy it, and if you do, go ahead and give the video a thumbs up and go ahead and subscribe to the channel for more content. Now let's hop right into this video. Here I will briefly review over premenstrual dysphoric disorder. This disorder is worth mentioning because it shares many of the symptom criteria that you will see with major depressive disorder. In fact, in order to meet a diagnosis of premenstrual dysphoric disorder, 5 of the following symptoms must be present. Now, before I get into those symptoms, like I mentioned earlier, this particular disorder shares many characteristics with major depressive disorder. And if you are interested in knowing more about that, go ahead and check out the previous video that I put out earlier this week, which relates to the symptom criteria for major depressive disorder. Now, hopping back into premenstrual dysphoric disorder. In order to receive a diagnosis of premenstrual dysphoric disorder, the following symptoms must occur during most menstrual cycles. These symptoms can be experienced the week before the onset of menses, with an improvement in symptoms within a few days after the onset of menses, in the absence or presence of minimum symptoms during the week post-menses. Now, one or more of these symptoms must include affective lability. So we're looking at emotional dysregulation in that case. Also, we may see irritability or anger. Depressed mood is often common, or self-deprecating thoughts or anxiety and tension. Additional symptoms that you want to be on the lookout for is a decreased interest in usual activities, so anhedonia, impaired concentration, lethargy, marked changes in appetite, whether that be an increase in appetite or decrease in appetite, disturbance in sleep, so hypersomnia or insomnia, a general sense of being overwhelmed or feeling out of control, or the presence of the following physical symptoms, which include breast swelling, joint or muscle pain. Now, all of these symptoms that I just mentioned, again, you only need 5 to meet the diagnosis criteria for premenstrual dysphoric disorder. But with these symptoms, we are looking at an interference with usual activities or relationships with others, and they must cause a significant clinical distress. And we also want to make sure that the symptoms that are presented are not exacerbated by another disorder. Now, as I mentioned earlier, these symptoms may oftentimes be confused with diagnostic criteria for major depressive disorder. The main thing you want to look for here is evidence of symptom onset the week before menses, and the symptoms alleviating days after menses. So when conducting an intake evaluation, we of course see the value in providing a biopsychosocial intake in which we acquire information related to irregular or problematic menstrual cycles. Well, I hope that information was helpful for you. If you would like to see more content similar to this, please leave a comment below. And again, go ahead and like that video. If you have more information to add to this discussion, please do not hesitate to leave a comment below. Until next time, happy studying and take care.